Well, my PPT is visible, sir.
Yes, sir. Visible, sir. Visible, sir. Just you close this windows if possible. Yes, sir. It's now visible, sir. Thank you.
Okay, good evening, all. So, I welcome you all for this exam orientation lecture series 2026 for the third professional BMS. So, as you all know, it's a high time. Your exams are fast approaching, and it's not the time just we just waste it. And again, once again, like you are the first what you call CBDC curriculum batch. So we usually will be telling. So your batch is like an experimental batch because NCSM has brought the CBDC curriculum, and now the first time you're all entering the final exam, and even it's new for us also. This is the first time where we'll be coming across this CBDC curriculum final year batch. But anyhow, you have written first year, second year, and all, so you have an idea like how your exam pattern, how your exam is going to be. So as the name itself suggests, so it's a time for you, for us to assess your competency, and that too because of this a new dynamic curriculum. Well, so the question paper pattern and all, by this time you might be known because all the many exam orientation series you have attended. And in Shalya Tantra paper 2 also, it is always the same. So you have multiple choice questions of 20 questions, short answers 8 and long answers 4 questions. And each multiple choice will be having 1 marks, short answers will be 5 marks, and the long answers will be for 10 marks, and the total 100 marks. So it's same for paper 1 and paper 2. Coming back to the subject Shalya paper 2, it's always sometimes when we speak to the people or when we speak to the students, we will be coming across like Shalya is having a vast subject. And again, in that Shalya, the paper 2 will be always sometimes little more. The students thinks it's like a hard stone because you have all the modern things, you have all the allopathic concepts, all individual systems are there. So paper one is little more conceptual, which is having Shara, Agni, Yantra, Shastra, which you are all little more aware in your first year with Ashtanga Hridaya and all. And those concepts are little more simple. But once you take up this Shalya paper two, no, it will be like a huge syllabus. Again, you know that when you take up any allopathic or what you call modern textbooks like SRB or Manipal or Das, you can see that it is a huge book, and what to study, from where to study, all those things will be. All those things will be difficult for you. But in that manner, always I have come across many students telling paper two is difficult, paper two is difficult. So it's always better to make a strategy to study. So once you make strategies, once you know the things, it becomes uh, quite easy. And one more thing I'll be always telling my students, like now, like when you open these textbooks and all, it looks very interesting. When you start reading, you feel like, oh, it's so nice, we should read. And I have even come across people who start reading right from the first chapter of the Das, like taking up the wound, and by the evening they see that that he or she has completed only 1 or 2 pages, and that itself will make them panic. So entire day I have studied only 2 pages, so how I can complete my syllabus, what to be done, what all the things I should focus, all those things will happen. So that's why I'll be always telling my students, at this juncture, you're not supposed to start reading the textbooks from the beginning and all. So definitely it is a very good, knowledgeable, you feel like interesting. Anyhow, you, if even if you have not read all these days, you have still more time in your internship and all you can take up. But now you should just concentrate like how you can manage your exams, because as I told, the allopathic books and all, it will be giving you very much in detail the things, concepts and all. And if you start concentrating those things now, you may not be able to complete your syllabus. You'll not be able to answer few questions that will make you panic, and that will definitely cause you what what can I say? You will be stressed, and it's not good also, because now your focus is to complete your syllabus, score your score marks, and come out with a good results. Because as you know, it's a final year, results matter. So wherever you go, suppose if you want to face any interview and all, the percentage will be as many times it will be of first years, though it is sometimes it is aggregate or in some private sector and all, or at least to tell to your family members, relatives and all, I have scored this much percentage. The final year marks plays a quite important role. So you should concentrate more on getting a distinction, more on scoring the percentage. Though you are not able to make up in your first year, second year, and all, in final year at least you should try to what score the marks. So that becomes your highlighting thing. So that will definitely make you happy. So in this juncture, at this juncture, when your exams are fast approaching, I just suggest you to concentrate more on your exam orientation rather than your knowledge. So, like studies is never-ending process, and knowledge gaining is always a never-ending process. It's each and every day you can gain the knowledge. Anyhow, like even if you have not studied the modern books, now you can do it in the internship. So, like this only, we will be always postponing. No, in first year I'll be studying in second year. In second year I'll be studying in final year. So, okay, that's apart. Now we shall just see how we can complete this, how we can manage this subject. So, especially paper two, how we can make this vast subject into like simple one. And anyhow, you all know that you have got a very vast, uh, a very clear cut syllabus copy. So each and everything they have given, they have described it. So from where you get MCQs, from where you get SAQs, from where you get LAQs, all those things has been given in your syllabus copy only. So that you need not, so that you once you can go through that, like MCQs will be majority will be drawn from the must to know part of the syllabus. Questions from the desirable to know part of the syllabus shall not exceed 3. Questions from the nice to know part of the syllabus shall not exceed 2. And SAQs will be majoritarily shall be drawn from the must to know part of the syllabus. Questions from the desirable to know part of the syllabus shall not exceed 1. No questions shall be drawn from the nice to know part of the syllabus. SAQs shall assess understanding, application, and analysis rather than simple recall. So all LAQs shall be drawn exclusively from the must to know part of the syllabus. No questions shall be taken from the desirable to know or nice to know part of the syllabus. So number of LAQs should not exceed 1 per topic unless maximum marks exceed 20. So these things you can just go through, but sometimes like you cannot completely rely upon this, because in Shalya Tantra and all there is nothing like desirable to know. If you want to become a surgeon, it's always like you should know each and everything. And even I heard, like I have come across, like the definition of Shalya Tantra becomes like a desire to know. But in the Viva and all, it will be like a basic question to be asked. Okay, tell me the definition of Shalya Tantra. So it's always like the important topics, the important concepts, and the frequently asked things should be, you must be aware. Even I came to know like in last year and all, in few topics they have not able to follow this in few subjects, but in few subjects they followed it. So now it's like a high time we can't take risk in the final year. So we cannot completely what depend on this. So what are all the topics are little more familiar, important, or it's previously asked, so that it's better for you to know that. So simply like excluding everything, telling it's nice to know, and in the examination hall it cannot be what always challenge. It's then it will become time consuming, you will be in panic, and we don't know what will be the thing. So what I suggest is like, because the paper setter should be very much aware of this, he should, or he or she should be very much what concentrating on this, because it is a first time. Even they will not be so much of what uh, completely aware of these things. So there are few questions which is like from many times we are frequently asking it, like that may be an important concept, important topic. So that question will be his favorite or her favorite, so she may set it, but later you can't cross check it and all. So 90% everybody will be following these things, but one or two questions are here and there. There may be slight changes. There may be some what variation. So you be prepared. So what are all the, because knowing the things or learning the things is always boon. So don't get too much like into this. You have a clarity of the things, but not. But at least if the question is asked, you should be in a position to answer it. So this is what I suggest. So this is regarding that. And your paper 2, as you all know that it starts with Bhagna. So in Bhagna you have all the MCQs, SAQs and LAQs. So in Bhagna, usually for the long 10 marks questions, it will be asked like define Bhagna, explain its classification, and what are all the modern uh, correlation for that, like define fracture and explain the types of fracture. So this is like a frequently asked 10-mark question. And also fracture of humerus, fracture of femur. So these are the few fractures which will be usually frequently asked for 10 marks. So you need not break your head of fracture of some pelvic, all those things, because it's not that quite important. So which are all the things which is frequently previously which are frequently asked are these LAQs, because they have huge stuff to write. Whereas clavicle fracture or shoulder joint dislocation or elbow joint dislocation, they don't have sufficient what materials or things to write it for LAQ. So usually what we have seen frequently from previous is like define Bhagna, explain its types, and explain any one of the Bhagna, or define Bhagna, explain its class and write the modern correlations, or define fracture, write the types or classifications of the fractures and explain clavicle fracture. So like this, they'll be clubbing the 2 or 3 questions and it will be shown. And the first time, one thing what you have to follow is when it is asked define Bhagna, your answer should start with the definition of Bhagna itself. You should not start like Bhagna is fracture. So fracture is defined as, most of the times in what we see is the same thing happens. You just what you know, you want to correlate it and you will be start writing it. If it is arshas is asked, you should start with the definition of arshas, types of arshas, and then you can go to the hemorrhoids in the conclusion. Or if hemorrhoids is asked, you start with hemorrhoids, definition of hemorrhoids, type of hemorrhoids, and then a small amount of correlation of arshas and that concept can be asked. So whatever the question will be asked, you be specific to that and start writing on that specific topic rather than whatever you want. If the define like humerus fracture is asked, you should start with the humerus fracture. Then you will not start with the definition of fracture, types of fracture, and then you will be like filling right in the last you will be writing a little of humerus fracture. That will not fetch you marks, and again that will be time waste. And you know that anyhow you are lucky that you have like five pages for each answer sheets. It will be what marked and given. So previously and all, what used to happen, like some people used to write 10-15 pages for one answer for 10 marks, and they used to concise all other questions into two lines. So such things should never be done. So make a point like you will attend all the questions. So whatever things you know, you write that regarding that topic in a very concise, in a neat format. It's not like if what like fracture of humerus is asked means you should start with fracture of humerus. It's not like you will start with the definition of Bhagna and all to fill the page. So that is not a right way to answer. So anyhow, we are discussing like in each topic which are the long questions will be coming. So you can concentrate on that. And also the fractures which will be having names like Colles fracture, Smith's fracture. So those fractures will be usually asked. So in exams while preparing, you make a note or you remember that the subject or the surgery or the procedure or where you have a specific name. So that has to be given more concentration. So the paper setter will be focusing more on that, like Smith's fracture, you have Colles fracture, and those things if you read, it is fine or it is well and good. So basic definition of the fracture, types and classification of the fracture, definition of the Bhagna, classification of the Bhagnas like Kanda Bhagna, Sandhi Moksha, what you have. So that can be clubbed together and can be given for 10 marks. And then individual fractures like humerus fracture, femur fracture can come for 10 marks. and then like shoulder dislocation, elbow dislocation, and you can get clavicle fractures for 5 marks. So these things you should keep in mind. And Colles fracture and Smith's fracture are very repeatedly asked fractures where there is the names of the fracture. So like this, you can give importance for the topic. On that basis of importance or weightage, you can start preparing rather than going and reading some tibia, fibula fracture in detail, patella fracture in detail. Rather than that, first, if you are completing these topics, then you shift to the like next priority topic, so that you have a confidence like you have read the important topics, and then you will be uh, glancing the other topics also. So even by chance, with bad luck, if you get such rare questions also, you will be able to answer it. Is that clear? So on such things, if you concentrate, it will be easy to score. So that is how you have to make a plan to what complete the syllabus. Or else if you start writing or reading now from the beginning, and you take up some metatarsal fractures, metatarsal bones, and you start making notes for that, you start making notes on some other hip joints, all those things in detail, definitely that will make you panic. It will time consuming it. And once you are not knowing what is Colles fracture, Smith's fracture, going depth to the patella fracture is of no use. So first, what I suggest is you concentrate on the topics which are quite important, which are frequently asked, which have been asked in your previous year's question papers. So that will build your confidence. In the first round of the study or subject, you have to finish all those important topics, and then you can shift to the smaller or minor topics. So this is what on the basis of the repeated study, on the repeated evaluation of the question papers, I'm just what telling you like the important thing. That does not mean that sir has told only these questions will come, this will only be coming later. If I get something else, you are not supposed to what curse me and all. But 99%, at least like first level will be your concentration needs to pass, the second level will be first class, next will be like distinction. So it depends upon the time, how much you have, how you have to maintain, because it's almost like 10 more days for your preparation. So at this moment, at this peak juncture, what strategies you should do, I'm concentrating on that. So because the paper 2 has been specifically given to me, so what are all the important things, or what are all the important what measures you should take, that I'm just sharing. Right. So next comes the Asti with the Vikara. In this, like there is no much like 10 mark questions you don't have. So they can just ask like osteomyelitis, osteoporosis sometimes, or Asti Shosha or Asti Ganti, like that it can come for 5 marks. So those things you can concentrate. And in the craniocerebral injuries or Shirobigata also, there is no long questions. So they can directly ask like describe craniocerebral injuries, or they can just like Shirobigata. So once they have asked just like examination of craniocerebral injuries disorders. So previously when there was a question for 3 marks they had asked, but now such questions can be asked. So you just prepare like now from this only 5 marks comes. So there is no long essays, long questions. So you need not break too much of your head. You just see that in these things, whatever I can remember it. So whenever you will be writing an answer, you should plan. So once you should read, and then you close your book and you just recollect. So if 5 marks Shirabi Ghata is asked, what I should write. So for every question in the next coming slides, I'll be telling it. You should start with a definition. Then you'll be writing the what you call it as uh, clinical features, then any investigations, and then management. For any question or any topic for that matter, you make these 5 headings and you read accordingly. So what can be the definition? What introduction I can give this? What is the causative factors? What is the clinical features? What is the management? So like this, if you make a heading and if you concentrate on that and if you take and read, it will be, you will be consuming less time also, and it will be good to recollect. Or else you simply start reading that, and then in DAS and all you'll get a pathology. You start reading the pathology, and you see in the SRB. In the SRB there will be huge description of the procedure. You sit and start reading the procedure, you get headaches. What is this? How can I remember all these things? Then definitely it will make you panic. So you have to make the things simpler now. So it's high time, like it's not for the sake of knowledge you will be now going through. you will be now you'll be concentrating more on like marks. You will be concentrating more for scoring in the exams. To score in the exams, these are the strategies you should plan. So though I read this topic now, in this topic, what I should write in the exam. If this question comes in the exam, what are all the side headings I have to make it. So you should recollect that side headings so that it will be easy for you to remember, rather than reading the pathology, rather than reading some other concepts. For each question, make this such heading and definitely you will be able to succeed. And Kasheruka Vikaras, that is diseases of the spine also, you have very limitations. You have just like uh, 6 marks together with Kasheruka and cerebral injury. So here it can be asked like lumbar spondylosis or listhesis or such, or sometimes port spine or ankylosing spondylitis. So like this names of the diseases which are there, so that you can focus. So even when the paper setter will be taking the questions, no such things will be highlighting. So ankylosing spondylitis is like you have a terminology. So for that you should prepare like if this question is asked for 5 marks, what I can write. So that is like a easy method to continue or complete the syllabus fast. And then you have stanarogas like diseases of breast. So previously and all, CA of breast was a very common question which used to be asked, but this time they have not kept it in the LAQ only. So 10 marks they don't have. So they have kept it only for 5 marks. So stana arbuda, stana vidradi, or fibroadenosis or fibroadenoma. So these things will be like a very frequently asked question. So fibroadenoma or mouse in the breast. So like this they can ask. So for this, what you will be writing, so that you should have a clarity. So C of breast also might can be asked for 5 marks if it is not there. Sometimes if the question repeats means it can come for 10 marks. So I just tell my students like when you read CA, which are all the CA will be very frequently asked or most important is like C of breast, C of stomach, C of rectum. This will be like a very frequently asked because for Shalya Tantra for final year student batch, these are the few CS which one should completely know. C of esophagus also they have asked. So first, it's not like you read some all because whenever you take up any system, you see that you have all the CAs, you have all the tuberculosis of that disease, you have all the congenital anomalies for that disease. So which disease has got weightage or which disease has got importance, that you should keep in mind. So in CA, it is C of stomach, C of breast, C of esophagus, C of rectum. So you are in like high time to prepare now. You are getting confused what are all the things I should read. You can just make a note of these things. So these comes as a priority topics. So these comes like a must to know if you because these are the questions which have been frequently asked. And by chance, somewhere, sometimes you can get other rare questions, but that will be hardly 1%. So the one who has to score, one who is thinking of passing, at least the basic what now we are discussing that he should know. So at least if you know this basic, definitely it is like you can pass the exam. Again, if you want to score distinction, if you want to go above that, you should be much more what well versed in all the things. But at least if you think like I just need a scoring of 50% of passing marks, these are like a very frequently asked questions what we are telling. And Ura Vikara, diseases of the chest is also very rarely asked. Injuries to the chest or chest injuries is a question which was asked previously. So like Ura Bigata, chest injury, because chest injury is a very frequent topic, and pleurisy. Pleurisy is like a very commonly asked because again I told no pleurisy you have a name. So that is what you call as Puphosavarna Shota. So when you take up in this syllabus, you just highlight such diseases and first you read that, and later on you can shift to the other smaller disease, and again you can see that it's hardly for what you call or a test disease is for 3 marks, so there is no much uh, weightage. And next you have this Annanalika Vikara, which is having only 2 marks because C of esophagus, Mallory Weiss syndrome, or esophagitis, or all these things were very much frequently asked, but this time they have put in your syllabus diseases of esophagus is only for MCQs. So you can just go through once all these things because Mallory Weiss syndrome or C of esophagus, esophageal varices, All these things are very commonly or frequently asked questions which were asked previously. So just go through once so that when you go through that, it will help you for your multiple choice questions also. So that you can keep in your mind. So that is what is esophagus. And Gulma and Shula Vyadi, it's like less weightage for in Shalya Tantra, because you know that Gulma and Shula will be again studying in the KC also. So in KC also they can ask, in Shalya Tantra also they can ask. But previously like that we used to tell, and once define Gulma, explain the different types of Gulma. Like this, the question was asked for 10 marks in Shalya Tantra paper 2. So sometimes such rare things happens, but we will be optimistic. We think like as per this criteria only the paper setter will be setting the questions. So you need not give too much of concentration on that. But if you study that, it will be useful for both KC and Shalya. So like this, you should start doing a smart work rather than I'll sit from the morning till night. I'll be reading one page of taking SRB textbook and I'll be reading from the beginning. So such things will not happen now. So now you should be quite fast. You should be quick in actions. You should know what you should write in the exams. You should plan the topic, and you should see that once you complete entire syllabus, because now you don't have only Shalya to write. You have all the other subjects, you have all the other papers. So scoring marks and getting pass in all the subjects matters. So first round thing is like you should finish all the syllabus once, and then you should go for second round, and then you can complete it with a third round. In the first round you will be reading all the like important topics which has to be studied. In the second round you can just glance all the little more difficult topics, and again in the third round the important topics has to be revised, so that you get a confidence of writing in the exam. And next, coming to the Udara. So Udara Roga also, previously Udara Rogas were like very much important. They had asked Jalodara, they have asked Baddha Gudodara, they have asked all the what once if it is asked Jalodara, if it is asked for 10 marks, you should write regarding Jalodara and then you should shift to ascites. If it is asked like Baddha Gudodara, you should write regarding the what Baddha Gudodara, and next you should go for like what you call intestinal obstruction, Chidrodara. So all the udaras which is having names like Ekrudodara, Chidrodara, Baddha Gudodara, Jalodara are very much important. So again the what modern correlations you can write like ascites, or it could be what perforations, or it could be what intestinal obstruction. So when you read, you take up an Ayurveda topic. In that Ayurveda topic, you will be writing what is its definition, what are its classification, what is the symptoms what I have told, and what is the line of management. Same like that in the allopathic, what is the definition of that, what is the causative factors, whether it has got any classifications, what is the investigations to be done, what is the line of management. For any disease for that matter, when you take up this paper too, you make such headings, you read once and you again recollect in this heading what I'm getting, what are its classifications, how I can remember the classifications. So to remember the classifications, what are the mnemonics to be followed. So like this, you can just what place your mind, and if you do a smart study, I'm damn sure that you are going to excel with a very beautiful colors. And next, the diseases of stomach and duodenum, it has got quite important. You have 12 marks for that, and you have all less yes, like you have MCQs, you have SAQs, you have got LAQs. So they have included all the what till what you call Udhara Bikata abdominal injuries is for 12 marks. So this is like a huge set of topics where you have to give much importance to all the diseases. Again, first you comes like all the diseases which is having the names. So like pyloric stenosis, or you have like a blind loop syndrome, or you have like a benign and malignant tumors, or intestinal obstructions, Baddha Gudodara, or intersusceptions, or perforations. So all these things are like a diseases which have specific name, so that it has to be mentioned. And again you have like Unduka Pucha Shota, that is appendicitis, is like a very hot cake. It's a very favorite topic for many of the people. It has been repeated many times for long question. Unduka Pucha Shota, or define appendicitis and explain the procedure. And also, uh, again, rectum and anal canal is our scope. Being a Shalya person, having a clear knowledge of all the anorectal diseases is a must. So, Arshas, Pagandara, Parikartika, and what Harbuda, all these topics, both Ayurveda and allopathy, you must know. So, again, what I suggest is you need not come from the first topic itself. You can start from these also, because these are all having higher what responsibilities. Like you have 12 marks, 15 marks, they can ask from these things. So you start first, like these diseases only, you start reading Arshas, hemorrhoids, Parikartika, like fissure in Bagandhara, like fistula in then C of rectum. Then you shift to diseases like Chidrodhara, Baddhabudodhara. Then you read both Ayurveda and modern. While reading, you read both Ayurveda and modern, so that you have some stuff. So whatever is asked, you can write it in a proper format. So sometimes what happens is like hemorrhoids will be asked. It is a very easy topic, but you miss because we have that overconfidence. Hey, hemorrhoids, I can write. Hemorrhoids, I know hemorrhoids. I have been hearing these rectal diseases since the beginning. So many a times, what the people or students do is they just ignore these small topics, and they will be reading some what hepatomegaly or liver abscess or Billroth 1, Billroth 2 surgeries and all they'll be reading. And the question comes is like define as write its classifications, because knowing the things is better, putting it in the paper is a different. So you may be heard of arshas, you may be knowing arshas, you may treat arshas also, but if it is asked for 10 marks, what you will be writing in the arshas, that matters, right? So you should write the definition of the arshas, you should write the synonyms of the arshas, you should write different classification of the arshas, then the four principles of the arshas like beshaja, ankshara, agni, shastra, karma, as per Ayurveda. Then you will shift to what allopathy, what is the definition of hemorrhoids, what are all the classification of hemorrhoids, what is the line of treatment for the hemorrhoids. So that should be written. So this neat presentation will fetch you marks. And so many times what happens is you have studied Billroth 1 and Billroth 2, and the question comes hemorrhoids, but you have not studied the hemorrhoids, you have not what revised the hemorrhoids, like how I should write in the exam. So you will not be able to write it. So then what the paper violator thinks, what fellow is this? He has not even studied hemorrhoids. So how can I give marks? So if you simply write something, they'll be putting very less marks. So suppose if it is some Billroth 1, Billroth 2, it's a very tough question. So then most of the people, most of the time, the students will not be reading that. So they'll not be writing it. So even if you just attempt something and if you write few sentences also, the paper validator will be giving you marks, because he knows that it is a tough question, it is not expected one. So at least he has attempted, or he has tried to make an attempt to know that. So you will be getting few marks out of consideration, because everybody will be losing it, everybody will be skipping it, and it will be a quite difficult question because the paper validator knows that. But once you in the what in the urge of scoring more marks, you are studying all huge big topics, you are taking serious all the difficult topics, and if you lose with this small topics, then you'll not be able to fetch the marks. So this is what I say, especially these things happens when you are in like a top who wants to score more marks, no, they just neglect this small topics, they think all these small topics I know. But knowing is a different thing, putting it in the paper is a different thing. So knowing the things becomes matter. So you should also know what all the things to be written, how it has to be written, how you have to present. So now it's time for you to concentrate. Ashes hemorrhoids everybody knows, but if it is asked in the exam, what I will write, what is the definition for Arshas I'll write, which are all the types of Arshas I know, how I'll write the management, what shlokas I have learned. So this thing you should keep in mind. So for all these diseases, what I think is the more easy the paper comes, the violation becomes tough. The more easy the paper comes, no, you will be scoring less marks, because assessor, because all those who will be correcting, they will be teachers in the class. So they knows that these topics will be taught by a teacher. So once that basic topic is not written by a student, they really get angry, and they just want to tell a person who don't know the basic anorectal diseases, what is the use of passing him in Shalya Tantra? So you will be failed. Though you know like cardiac surgeries, you know thoracic surgeries, but basic when you have not written this, you will be losing the marks. So what I always suggest students is to cover all the easy basic topics also first. Like in the same paper, in the paper one, like Yantra and Shastra. So you will think like Yantra and Shastra is easy. The topic is easy, you know, but how you will put it in the paper, that matters. So evaluator will be checking what you have written. You may be knowing the practical aspects, you may be operating the things, you may be doing it, but once you are not able to present it, no, it becomes difficult. So I always suggest the students to start reading from the easy basic topics. You just make those easy basic topics as your fundamentals. So once you finish those topics, once you're recollecting those topics, even you will start getting confidence. Oh, I know something, if question comes I can ask. Or else you start reading the cardiac surgeries, you start reading the thoracic surgeries, you start reading the cerebral things, you will not be able to grasp it now. So you are getting what you are forgetting it, so you become panic, so you're losing the tougher here you are losing the what simpler topics also, because you are investing most of your time on these unwanted things. So don't start doing all those things. First you make yourself confident on the very easy topics, like paper one you make first confident, and then in the paper two, as I told, like you take up these diseases of guda vikaras, small intestine and large intestines, and then you shift to mutra vikaras, all those things, then the things becomes quite easy. So these things are like once they had asked abdominal injuries for 3 marks, so that will never be asked for 10 marks. So putting more time on those things is of not much use. And again, coming to the diseases of vikara, yakrat vikaras, you know that uh, you have egret liver injuries, you have liver abscess, and you have liver tumors. So that will be always asked many a times. And you have like what you call it as uh, hydatid cyst. So though in your topic there is no mentioning of the hydatid cyst, but that is a very commonly or frequently asked topic what you should keep in the mind. So like that you should see the weightage of the topic, and then you should go for the things. And next comes the disease of gallbladder. You're very much clear, cholelithiasis, cholecystitis. So first you go for that Charcos triad, and in this appendicitis, Murphy's triad. So the things which are having names, and also the tests. So sometimes what happens is the basic test alone can be asked for 5 marks, like Rawlings Singh's test. So which are all the tests for appendicitis? So like individual text in the varicose veins, they can ask like an individual test for 5 marks, or they can ask like explain 3 or 5 types for 5 marks. So such questions are also expected. So which are all most familiar, which are all more what in use. So you concentrate most of the times on that. And in pancreas also you have like C of pancreas, pancreatitis. So all these things becomes much what familiar for you, and those things has to be concentrated on more. In the spleen you have rupture of spleen, and you have like what splenomegaly or splenectomy. So for all the what splenomegaly, or it is rupture of the spleen and all, the line of treatment is splenectomy. So that you should keep in mind. So first you read those important things, and then you can shift to the next major things. So and in the kidney diseases, with kind disease of kidney and uterus. So here the most commonly is like congenital anomalies of the kidney is quite important, because congenital anomalies of the kidney, there are like mentioning of almost 5 6 names, which is not very much in all other diseases. Though when you start reading each individual system, for all system there will be like congenital anomalies, there will be always CA, there will be always the tumors, always there will be injury for that. So you might have seen, so for all diseases it's tuberculosis of spine, tuberculosis of chest, like that will be coming. So in which topic what has to be concentrated, that you should little use your mind. So like congenital anomalies of the kidneys is frequently asked many a times in the previous year's question papers and all. We get the description of congenital anomalies, so that you should concentrate. And like, and again most commonly will be like Ashmari, renal calculi. So this renal calculi is again important from the point of view of KC also, in Shalya also. Because this is like day to day, we'll be seeing the patients, we'll be getting the patients. So we have to concentrate on such diseases rather going for some tumors of what you call it as tumors of kidney. Instead of going like that, you can concentrate more on the important diseases. So Mutragata, Mutrakasha, knowing the names is what is important. And then the disease of prostate, the BPH is very much common. So benign prostate hypertrophy is like a very frequently asked questions. And in diseases of major vikaras of pain, it is phimosis. Nirodha Prakasha is very commonly asked. Circumcision is the procedure which is very frequently asked. And disease of scrotum and testis like what it's like anomalies of the testis, congenital anomalies of the testis is frequently asked. And with the roga, you know that hydrocele is the thing what will be very much frequently asked. And in antravriddhi hernia, the major inguinal hernia, femoral hernia, umbilical hernia, so that has to be read first. So first, like you can read definition of hernia, types of hernia you can read, and hernioplasty, herniorrhaphy, what is the basic surgical intervention for the hernia. So that you should read first, and then you should shift to inguinal hernias, or you can shift for umbilical hernia. So this is like a gist or a glance I have done with your topic, because I know in this high time I should not take much of your time. So it's already like I'm nearing the time. So I have told it superficially. And if anything, any details, any in depth you want, you can definitely, I can ask the organizers to share my number. You can text me, you can call me, and you can speak to me. We are there to help you out, nothing to worry. So this is like superficially, which are all the topics are important on which you should give more concentration, that I have been highlighting. And next comes in the Shalya paper 2. The most frequently people will be getting panic. Oh, every surgery has got a procedure. Whether we should really read this surgery. And when you now open this SRB and all, you feel. Actually, once you open, you feel happy. Oh, this much detail they have given. Oh, this much in depth I have to read. You feel interested, but once you close the book, no, you feel like, oh, what I should write. I am not getting anything, so that makes you panic. So what I suggest is, if you want to write the surgeries, so first concentrate mainly on like 4 or 5 surgeries which is frequently asked. So in the previous years, in all these years, what are all the questions we have checked, question papers we have seen? No, the 5 surgeries will be like appendicectomy, cholecystectomy, hemorrhoidectomy, and this hydrocele, tapping, and you have this hernia. So these 5 are like very, very much important surgical steps where they will be asked, like Unduka Pucha Shodha, explain appendicectomy in detail. What is cholecystitis? What is the line of treatment? Explain cholecystectomy. So whenever the surgeries has been asked for a UG level, for a final year student, more than this, they don't go for this any surgery. And even in that surgery also, what you should learn is, first you should learn what is the incision you'll be putting. So which is the incision which will be commonly used. So for this appendicectomy, like you have like the specific uh, incisions. So if you learn that incisions, that is also great, like commonly used incision, gridiron incisions as incision. So this is a book from Rajneesh V. Giri sir written. So this is the old Rajneesh V. Giri sir's book, the small pink color book. So you can see here surgery for appendicectomy. He has given it in the points. So rather than going for like a huge class, what SRB, Manipal, or sometimes I see students start reading Bail in Love and all in the final moment. So all those things will literally make you panic. So this book, I really felt like for a glancing, for a revision type of thing, it is very easy or very simple. So I just, for a sample, I took the photo of that. You can see here for appendicectomy, these are like performed under general anesthesia. Entire abdomen is prepared and wrapped. Commonly used incision, gridiron incision. As the incision is deepened, external oblique is divided. Internal oblique and transverse abdominis muscles are split. Peritoneum is opened. Pus serous is present, removed. Using the tinea coli as landmark, cecum is identified. Cecum is withdrawn and appendix is identified. Inflammatory adhesions are broken. Back box forceps is used to hold appendix. Base of mesoappendix is enclamped. 2-0 ligature applied around the appendix, close the cecum. Appendix is excised. Pursue string suture. So here holding with back crocks, pursue suture and the incision. Like this, at least if you write 3-4 points of related to that, definitely the examiner will be giving you marks. They don't expect you to write with individual muscles, all those things. Now if you want to score high, if you are well versed, it is well and good. I don't what demotivate, because learning, reading and all, it's individual, customized. So but even if you read in a SRB textbook, this book will be good for you to revise. So in that view, I have taken the photos of each things and I have kept it in the thing, because this is what many students I have come across. They will be asking me, sir, surgery, everything we have to read, or what, sir, surgery we should write, or what, so how we will write the surgery. So how if they ask in appendicectomy again, because in the long question, in the practicals also, in the long case comes, means sometimes in some colleges they'll be giving chit, in that they'll be giving the diseases. So there you have to write the procedure, surgical procedure. So to know or read the surgical procedure, this book I felt quite easy, simple. So I've just taken that. So here also they have given for inguinal hernia, they have given everything point wise point. So when you write it in a point, hernioplasty, herniorrhaphy, everything they have uh, highlighted with the points, it will be very much useful or well and good. And here you can see the hemorrhoidectomy process. So hemorrhoidectomy is also very quite frequently asked surgical procedure. So how hemorrhoidectomy has to be done, in the point wise they have what shared it, like indicator for large hemorrhoids, patient is anesthetized, V-shaped incision is made, blunt dissection. So for UG level, for your understanding, this is quite an important, like a revision book you can use. So even for the Bagandhara you have, so this is like cholecystectomy. So for cholecystectomy you have lap cholecystectomy, you have open cholecystectomy, whether I should read both the cholecystectomy, which cholecystectomy procedure I should read. So it's very depth, sir. All these things we come across. So for that also you can see that the cholecystectomy has been very much superficially they have included, like part is prepared, patient is prepared and anesthetized, a right subcostal incision is made. So if such procedure comes, you remember the incision. For a UG level, remembering incision itself is something makes a violator happy. If you write it, it's well and good, but if you remember the incision, that's much more important. And also I suggest you to read the procedures which is having the names, like Billrot 1, Billrot 2, or jobless procedure. So jobless procedure where you do for this hydrocele and all. So when the surgery is having a name, so such surgeries you can go. So first you go for these five, like very important: appendicectomy, cholecystectomy, hemorrhoidectomy, herniatomy, hydrocele tapping and all. Later you can, like second round, if you have time, if you have, you can manage with these things, you can go for the surgeries with names like Billrot 1, Billrot 2, or it could be like jobless procedures. The surgeries which are having names will be asked, like Procedentia, TS operation, where there will be like such things you can concentrate. So I think this is a very important, or lot of people break their head thinking paper to modern. So surgery, it is all surgical procedures. So which surgical procedure I should study, which surgical procedures I should know, what surgical procedures I should write, how I will write. So for that purpose, so this is one of I think what hard part in the paper to remember the surgery, to write the surgery. So to make it simple, I am giving the reference of the book and I've just shown you how it has been viewed, because this is not the new version of Rajneesh Giri sirs. This is the old book of Rajneesh Giri sirs. In the new book, I don't feel like surgical procedures like this and all has been mentioned. So it's a small pink color book. It is very handy also for revision. It can be used. So coming back to the general guidelines, I'm sure like all these days you have heard with all other people. So everybody might have highlighted all these things. So I just don't take much of your time in these things. So know the exam pattern, plan your study. Revision is always key. So revision in the sense it is recollecting. You may read for 18 hours a day, you may read for 20 hours a day, but if you don't recollect it, it becomes waste because mind has to be prepared right there. How you will recollect is how you will write in the exam. Suppose if appendicectomy is asked in the exam, so what first I'll write? First I'll write the definition of appendix, then what is appendicitis, then I'll go for appendicectomy. In appendicectomy, I'll write with the incision, I'll write with the procedure, then I'll correlate. In Ayurveda it is mentioned as Unduka Pucha Shota, then I will conclude it. So like that you start explaining yourself, you start telling yourself. If you do a combined study, if you explain to your friend, that is also well and good. And definitely the more you do revision, in the sense recollecting, that will help you. And definitely stay positive and healthy. Everyone can do, everybody will be scoring good, everybody can pass final years. You might have seen in all the colleges, in the first year there may be like 10 or 15 members failing, in second year there may be 4 or 5 members failing, but in finally it will be hardly 1 or 2% will be failing. So because the students will become much more aware, it will be final sem, because all these years, even if you fail also, you can go to college. So I'll be always telling, nobody will come to know whether you have got a subject back and all. But in final year, if you lose a subject, no, you have to sit at home 6 months. So all your neighbors, kith and kins, aunties and uncles will be asking, checking why is not going to college. So everybody will be coming to know. So concentrate, dedicate yourself. It's high time. So most of the times, if you're not doing a PG, it will be like your last exams, because you may be scolding who has invented this exam and all. So first, the exam was started in China for the selection of the people. In India and all, we had Gurukul system where they used to do like Tadvidya Sambhasha, they used to recite, there used to be oral discussions, there used to be what recitations like all Shastra, Paran and all. But formal writing examinations and all came from the 19th century. So from 19th century, England adopted this China's method of like selecting the people. And once the British education system started in India, they started doing this exam. And also sometimes what happens is like in this last moment you'll be reading more, and so the brain also will be like over much powered. So sometimes you just lean back and you'll think some small question like definition of Shalya Tantra, and you may feel like Tatra Shalyam you may not get. So then you should not get panic. Oh, I studied all these things. Now I'm not getting this simple. Gone. I may lose my paper. I may not get be able to write. So why to study? What to study? Don't go panic like that, because sometimes because of that overexertion, overcrowding and all, the brain will get such uh, what such a kind of scenario. But once you sit and start writing in the paper, definitely it comes. So definitely the brain will help you. So now like once you start studying for 10 hours 12 hours continuously, in the nth moment you may start feeling like you're exhausted, you're tired, you're not able to remember all those things. But once the answer sheet is given and you start writing, definitely it will be coming. So stay positive and healthy. So exam tests your preparations, not your worth. Give your best and leave it rest to the God. It's always like that, no? Once you're completely prepared for the exams, automatically a thought comes from your mind. So I have done my part of the work. Next is up to you. Only when you have not prepared, oh, I have not studied the Ekrat Vikara, oh God, let the question come, does not come from Ekrat Vikara, let the question come from only this. So that what you call the dilemmas, that stress will be there when you're not properly prepared. So it's always like you do your part of the work. That is what is karmanyevadikaraste ma phaleshu kadachana. So when you have done your karma perfectly, automatically that bhava comes. If you have not done it karma properly, you will be distressed. So whatever it may be, so don't now sit and get panic like I had not studied previously, I could not do that. Still time is there, you can do wonders, you can do miracles. Even if you sit 2 days for one subject, definitely you can pass this exam. So have exam day guidelines, reach the exam center on time, carry required documents and stationery, following seating and instructions, because all these things sometimes in the nth moment you will forget all ticket, you will forget your ID card, and nowadays they have made it like ball pen, black ball pen point is must. So all those things you keep it ready, because those things also matters, because the presentation matters. So during the exams, read all the questions carefully, manage your time effectively, attempt what you know first, write neatly and legibly. And this is also nowadays you have a chance, like because question numbers has been kept, you can write it in that questions, I think. So don't mix the questions, like one you will write 10 mark question and you will switch over to 5 marks, 2, and then again you will come to 10 marks. That is a very bad habit that should never ever be done. Why? Because the evaluator will be thinking this is the 10 mark questions, and he'll be putting 10 marks in between. If you start writing first, you will be writing 3 5 marks questions, they'll be putting 5 out of 5, you'll be putting 3 3, and in between you take up a 10 marks question, and then the validator mind will be there like it is a 5 marks question. So he will be putting out of 10, he may think it is for 5, he may give 3 or 4, but that is your 10 mark question. If the validator knows that it is a 10 mark question, no, definitely he may put 5 or 6 marks. So don't jumble the questions like that, you completely write it in a series so that it will not confuse the validator. Definitely validators will be fine enough to check, they'll take time, they'll be seeing, and then they'll be assessing. But in, and again, now it's all computerized, it's not that easy. But even then, when we collect personally, we feel like whether it's a, we need to cross check, it becomes difficult. So don't jumble the things like that. So do not indulge in unfair means, be honest and ethical, respect the rules of the investigators. So this is what is I want to stress on that, because time management matters a lot. So here you can see the first 2 pages, your handwriting will be so nice. In the middle pages, it goes worse. In the last pages, it will like a ECG, which you cannot read. So instead of doing all those things, so you have, this is a small assessment which was done by some, like total duration you have 180 minutes, the 3 hours. So for each long essay questions you can utilize 15 minutes, you'll be getting 60 minutes of time. And for each short essay questions you can utilize 10 minutes, you will be completing in 80 minutes. So for each multiple choice utilize 1 minute, so 20 minutes. So even if you complete your answer paper for 160 minutes, the last 20 minutes will be again left, so you can fill it. So anyhow, now if they have given the pages of 5 5 and all, you start writing for at least 3 pages for all the questions, and then you can come back and you can fill. Because when we were writing and all, we were writing together, so we used to leave some space in between and we used to go for next. And if you don't get time, that space filling will used to become difficult. But nowadays, because of this questioning marks, no, it's not tough thing. So it's a good. So don't, because you have studied Arshas very well, they have asked for 5 marks, and you will write all the 10 pages thinking everything. And for that one question, you will spend 45 minutes. And again, all other 10 questions are left, though you know you will be not writing it. So that is a very bad thing, because even if you know, if you write 100% also, the maximum marks you'll be getting will be 8 or 9. So if you write 8, so if you write 3 questions properly, in that if they get average 5 5 also, you will be getting 15 marks. So instead of 3 questions, you have written one question completely exactly, also maximum marks will be getting 8 or 9. So there is like almost a difference of 6 to 7 marks. So I always suggest the students to complete the paper, so attempt all the questions, and then you can shift to the next thing. So this is what I always suggest. So what you start in the beginning should be there till the end. So this probably I have told in the beginning itself. For any answer for that matter, start with a definition, then give an introduction, then have a clinical features, go for investigations, then you write the management, then you have a correlation of Ayurveda and modern, and then you can conclude. So this habit you develop while studying only from the beginning. Suppose if you are studying this question, so esophageal varices. So what is the definition for esophageal varices? Whether there is any types for esophageal varices? What are the causative factors for esophageal varices? What is the clinical features of esophageal varices? What is the investigations to be done in esophageal varices? How we will manage? What is the management for esophageal varices? Then you'll be concluding it. So while starting from the studying only, if you start doing this, no, it becomes quite easy, rather than simply opening a book, reading from beginning to last, and again not getting anything. For any answer, you make this such headings, which will be definitely useful. And I just conclude. Stay focused, manage your time, write with clarity, stay calm, positive. Your consistent effort will definitely bring success. The future depends on what you do today. Success is a sum of small efforts repeated day in and day out. And arise, awake, and stop not till the goal is reached. All the best. I pray God. Let God bless on all of us. Let everybody be happy. Let everybody come out with a what? Colorful result. Prepare well. Stay positive. Perform your best. Achieve success. So with this, in this given time, as you all know, like it's a huge topic, huge syllabus, and in this nth moment, I don't want to take much of your time also. In the given time, what small suggestions I could give from these many years of experiences I have just shared with you. I'm always open up for suggestions, discussions, or any of your clarifications. My number, everything, you can share it, and definitely anything, any help from our side, what best we can do, I'll be happy to do it.
Thank you, sir. Thank you so much for your guidance for our students, sir. They will follow your guidance 100%, and they will success in their life and in the exam also, sir. Thank you so much. Students, do you have any questions? If you have, you can ask, please. Do you have any questions? I think Dikshit has raised hands once in session. Yeah, Dikshit, do you have any questions? You can
Sir,
ask.
namaste, sir. Hello. Sir, namaste, sir.
Yeah, namaste, tell me.
Sir, that pattern of must to know, desire to know, must to know is followed or not, sir?
It is followed as far as my knowledge is concerned. It has to be followed. It will be followed, but one or two questions we cannot predict. In your second year also, I heard like it came like that. But sometimes they may change the question, they may not change the question because it's, I told her, yours is like an experimental batch. So even the final years, you are the first people who are writing this CBDC. So from after your exams, we'll be able to assess.
Thank you, sir.
Any other questions? Students, if you have any other questions, you can ask. Otherwise, we can conclude the session. Do you have any questions? At the end, if sir is permitted, can share your numbers in a group, sir. For
Yeah,
students.
definitely.
Yes, sir. Yes, sir. I will share the sir's number in the group. Thank you so much, sir. Thanks so much, Ayyanna, sir, for our request. You have given very good class for our students, sir. They will follow and they will take very good marks in all the subjects. And thank you from our Ayurreshmi and best time for our students. Thank you so much, sir.
I also thank for giving me an opportunity. So you're doing it as a service. It's very good. In colleges and all, in our colleges and all, we'll be doing it as a regular. But this is like across India. You have put on your efforts to bring all these people, and made uh, you have made this program a grand success. I wish you all the best. I wish you success for all your future endeavors also. So whatever any help from us for your what endeavors, I feel I will be happy to be part of it or associated with it. So I also thank, in spite of their busy, hectic exam time, these many students have come up. So with my sharing of knowledge, rather than knowledge, my sharing of some what you call experiences, if it has helped you all, I feel really happy. And anytime, any help, you can definitely approach me. We are there to help you out.
Yeah.
I hope I was able to reach your expectations. Thank you. Thank you once again.
Thank you so much, sir. Namaste, sir. And students, today is our last session of orientation. And I had recorded all the recording. I will send you by tomorrow evening or today night, and be there in the group. If at all you have any doubts other than the during examination, so you can ask in the group. We will try to solve your answers. Yes, then you can ask if you have any question.
Sir, I didn't register to that, sir. Please add my number in WhatsApp group.
Yeah, please send to the to my number. I will add you.
Sir, I messaged it, sir, in chat.
Okay. I will do. Thank you so much. Thank you, sir.
Thank you.
Thank you. Thank you for thank you so much. You're ending the session. Thank you so much. Namaste.